Hi everybody, welcome to today's session, and I am delighted to introduce you to the first doctor that I have actually interviewed with this series. You're going to be meeting Dr. Sonja Sattler, who is a GP in Germany, and she founded the Rosenpark Skin Clinic in 1996 with her husband, Dr. Gerard Sattler. They're very well known for the work that they do. Her background is actually in dermatology now. That's been her focus for many, many years. And not only does she run the practice, she mentors the whole of the team. And also for the last 18 years, she's also got another bow to her belt as Associate Executive Director for the International Society for Dermatologic Surgery. And there, Sonja actually organizes twice a year renowned conferences, and that's focused on advanced training for dermatologists and surgeons. So this lady is working very much with clients on a daily basis. We were actually introduced through a dear friend of ours, Magali Mazet, who is also a practitioner of the healing arts. And I'm delighted to meet you today, Dr. Sonja Sattler. Thank you for joining us.
Thank you so much. I'm happy to be with you.
Thank you, thank you. Really, let's get straight into it. Now, the reason I was really excited to speak to you is most of Europe has now gone into a second lockdown. You guys went in today, we went in on Friday. You know, the United Nations is stating Europe's pandemic restrictions are absolutely necessary, but many people are now rising. They're showing their disdain, they're showing their defiance of the measurements, which many people feel are unnecessary. So what I'd like to do with this conversation is clear some of the myths that we're hearing and educate the listeners on fact. So COVID-19, we know, is a respiratory disease, and especially it's one that reaches into our respiratory tract, and this includes our lungs, and then the infection travels into our immune system. Then our immune system starts to fight back. So Sonja, if you can tell us, what is it you treat, and what is your experience of the immune system?
So maybe we should start concerning COVID-19 and the immune system. We should start with the claim COVID-19 is a new disease. It's a disease also new for any medical doctor worldwide since the beginning of this year. So what happened in the first days when we found out about this disease, nobody really knew how to treat it and how to deal with it at all. So in my belief, and we all doctors know that, we have done, not on purpose, but there have been many mistakes in the beginning in treating the patients because nobody knew. We thought about influenza, then we found out in the pathology department that there is not only the infection of the lung, but also the heart and other parts of the body. So to be honest, today we know a lot more because the medical community is not sleeping, and we do know a lot more how to deal with this disease. You need your immune system for different approaches. You know, the normal immune system decides between good and bad for your body. So it's trained which substances, bacteria, viruses are good for your body. These will not be attacked, and others who are not good for your body, they will be attacked by our immune system. So our immune system, to keep it simple, works like a police. So the first, what we thought and what we did, we thought we have to stabilize the immune system, which is correct, fully correct. But we do see that COVID-19 does different things. So it does clog blood cells, not only the red, but also the white cells, which are the immune cells, which is new. We have no other disease like this. We know autoimmune diseases. Autoimmune diseases are things like arthritis, or we have autoimmune diseases for the thyroid, for example. This is when the immune system works against our own body tissue. But here the immune system is working against the virus. So we have different kinds of patients. You know, some patients have a good immune system and other patients have a overreacting immune system. These are especially the patients with allergies. Mm-hmm. And so the immune system is everywhere. To close this here, maybe we have more specific questions on that. So we need the immune system to fight COVID-19.
Okay, so if we look back at now what's happening here in Europe, Germany, UK, pretty much all of Europe, apart from Sweden, I think, we've gone into this second lockdown. So on the 31st of October, this is what our Prime Minister, Boris Johnson, said. He said that without action, deaths would reach several thousand per day. There would be a peak of mortality, which would be worse than the country saw during the lockdown in April. And he said that we need to be humble in the face of nature. And he added that the virus was spreading even faster than the worst case scenario envisaged by scientists. So they were his words. Now, I've been speaking to my family in India, where people are pretty much going about their normal business now. India is a country with over 1 billion people, where sanitization is a lot more challenging. And so if what Boris says is correct, and this is a global virus, this is a virus that's is affecting us globally, then wouldn't we be expected to see thousands of bodies by the wayside by now? Isn't this the case? What are your thoughts?
Well, I think you're fully correct. You have to look into countries like India, and then we should do some scientific work there and see why in India there are not so many dead people. They have a high number of COVID-19 infected or positive tested, let's do it like this, but they don't die. And you know, India has not the same access to medicine as we have in the UK or in Germany. So we should expect a lot of more dead people in India, but we have not. So there's more to it. It's not only that we need some medication, it's probably your immune system, which has been built up in your childhood, maybe. In Germany, I don't know if you have this disinfection called Sacrotan. We have a disinfection called Sacrotan. So we always say we have the Sacrotan youth at the moment, which has been raised everything clean, which is probably not good for the virus.
Yes.
Because our immune system is not educated well.
Yeah.
So in India, it seems that there's a much better educated immune system. It can rely on sun, it can rely on meditation, happy living, and it can rely on your food, vegetarian. We don't know yet really, but we should look into that.
Yeah, definitely. Yeah. And actually, as an Ayurvedic practitioner, from the Ayurvedic perspective, we look at the virus. It's an airborne virus, and yeah, certainly from the Ayurvedic perspective, we see it's affecting people with pre-existing conditions. So people who have respiratory conditions. And in Ayurveda, we look at it in a sense of it creating more, we call it armor in Ayurveda, so more toxins in the body and more congestion. And because of that then allows the disease, a disease such as COVID-19 to impact the immune system more so. But also ways of treating exactly what you said. Certainly my recommendations would be reducing certain foods, certain sweet foods, and choosing daily movement, so more yoga, more mindfulness, and self-care. So now, in your opinion, do we need a second lockdown?
That's a good question. We do know much more about how to treat the patients. You need to know when you get infected with COVID-19, you have about 10 days before you could go into serious conditions. So usually in about day 4 to 5, you see first symptoms like sore throat or running nose. So usually then the people go, at least here in Germany, they are tested. So when you have a positive test, then we know that we nowadays do every prophylaxis, which is easy. It's an anticoagulant against the red blood cell clot. It's a medication every country has. It's cheap, like not saying aspirin is enough, but the aspirin plus and others. As well as we need something to influence the white blood cells, which is dexamethasone. It's also cheap and well-known medication. So you should, when you get tested positive, you should really go to your GP and speak about this in little dosages, and then probably nobody will end up in serious conditions. Mm-hmm. Except, of course, if you have a heart disease or lung disease, you are more to a problem. But to be honest, I don't believe what Boris Johnson said, because I think we are much better on the way now, 8 months later, than in February, March, this beginning of the year. So as doctors, every GP, every other knows more about COVID-19 and how to deal with it.
Yeah. And Dr. Sattler, I know you talk a lot about positive mindset, how to stay happy. What would your advice be to the people of Britain as we approach this second lockdown?
Well, maybe one side sentence to that. I'm working in the aesthetic field and make people happy as a doctor. And I think that your psychology is your biggest enemy also in COVID-19. So I think everything what fears you and which makes you tired or you feel not good is not good for you during this period. So I don't like the media in Germany, at least, because they all do the fear, oh, you shouldn't do this and you should do that. They should do positive thinking. So positive thinking, good looking, taking care of yourself, going out to the sun and feel well. This is what you should all do. And I hope these political lockdown decisions will not remain for longer, because for me it's not the way to go. Where is the end? Where is the goal?
Yes, the goal, I think that's it. That's the big question now. It's if we look at this from a higher perspective, it's what is the end goal? We can't. It's impossible to isolate something that's here with us. It's living with us now.
It will be there always. You need to also have this sentence once. We will not get rid of this virus, but we have to deal with it in a normal way. And we will come to this point for sure. With or without vaccination, we will have a normal life with COVID-19. We just need to know maybe a little more from the medical perspective, but we need to push our immune system to be happy and healthy.
Wonderful. Thank you very much. Thank you.